Hello, this is Dr. Brandt Gibson, and today we're going to talk about diabetic neuropathy. One of the most common causes of peripheral neuropathy is diabetes. In fact, it is probably the most common in the United States. Most doctors, when they give you a diagnosis of peripheral neuropathy, will do testing for diabetes. In fact, a lot of times they will do multiple tests. They'll do it over and over again because they're saying, well, you have to have diabetes because you have peripheral neuropathy. You need to understand that's not true. Not everybody that has peripheral neuropathy also has diabetes. However, if you do have diabetes, it's a very important disease process that you need to get control of if you really want to be able to control your peripheral neuropathy. So to control the nerve damage, you need to control the diabetes. So let's give you a little bit of background. So diabetes truthfully needs to include diabetes itself, the diagnosis of type 1 or type 2 diabetes. It also needs to include the pre-diabetes or borderline diabetes that often people are given as a diagnosis. Borderline, I don't like that term. Pre-diabetes is also questionable. It's basically a situation where you're not quite at the level of blood sugars to be diabetic, but you're at the levels that say you're at very, very high risk for diabetes. Now, the other group in this category that should be considered is those that have family members with diabetes. So, one, how do you know if this is part of your problem? How do you know if diabetes is the reason that you have peripheral neuropathy? Well, if you have the diagnosis of diabetes, you need to assume that this is one of the problems that are causing damage to your nerves because high blood sugars will damage nerves. I will get back to that here in just a second. But first, let's take a step back. So how do you get the diagnosis of diabetes? If you have type 1 or type 2 diabetes or even borderline diabetes? Well, the best way to do that is there are 3 different types of tests that can be done. A fasting plasma glucose test, where you're actually testing the blood to see what your blood sugar is at. A normal blood glucose, fasting blood glucose should be less than 100. Pre-diabetes is considered 100 to 125. And diabetic, those with diabetes, is going to be over 125. That is the current numbers. Like you see, they don't consider you normal if you have less than 125. They consider you borderline or pre-diabetic, pre-diabetes. And so you're still at high risk until you get below 100. There's also an oral glucose tolerance test, which is a test to determine how well your body handles glucose, how well your body is adjusting for it, and how quick it reacts to the blood sugar spikes. These numbers are a little bit higher because they actually give you they give you a drink of sugary solution, and then they do a fasting plasma glucose level that at that point then retested at 2 hours. And the 2-hour level, the second test, could be diagnostic of diabetes if your normal blood glucose is above 199. So with that spike, if it stays above 199 2 hours later, then we worry about diabetes. Pre-diabetes would be 140 to 199. And if you're less than 140, they consider that normal because they gave you a glucose load. And that means your body is adjusting, your insulin levels are rising in such a way that it's lowering your blood glucose. The most effective and often the most valuable test when it comes to how well you're controlling your diabetes and how well the body is managing blood sugars is the hemoglobin A1C, which actually tests to give you what your blood sugar average has been over the last 2 to 3 months. So normal would be 5.6% or less. Pre-diabetes is 5.7 to 6.4, and 6.5 and above is considered diabetes. Now, for a long time, they told you 7. The numbers now are saying 6.5 as being more accurate, saying, okay, if you're above 6.5, that means your blood sugars have at least gone up at some point during this time. So now that you know whether you have the diabetes or not, how does it affect your nerves? Well, the easiest way to describe it, oversimplification, is to say, okay, if you sugarcoat anything, it doesn't work as well. If you sugarcoat a blood vessel, it's not going to expand and contract like it's supposed to. If you sugarcoat a nerve, the electrical current's not going to flow as easily. But what we're really seeing internally is in certain types of blood sugar spikes, you can actually damage the sheath, which will slow down or interfere with the nerve signal of those nerves. You could also get modification of the nerve cell itself because of the sugar coating or because of the high blood sugars, and you get where the mitochondria are damaged or the cell walls are damaged, or whatever, and it's causing so that the cell doesn't function, and it can ultimately lead to cell death, especially in the smaller nerves, if you continue to have high blood sugars. So how do you control the nerve damage if you have diabetes? You're not going to cure diabetes. You're not going to take it away and say, okay, I no longer have it. There are things you can do with the way you eat, the way you exercise, and so forth to get really, really strict control on your diabetes so you don't have to be taking medications and they treat you like you don't have diabetes anymore. But the disease hasn't gone away. Your control has improved so much that it keeps control. So if you have a diabetic neuropathy, you're having neuropathy symptoms and you're saying, okay, I need to control the nerve damage so that I can live a normal life, the best thing is to control your blood sugar. Get your blood sugar strictly under control. So what does a strict control mean? Your fasting blood glucose should be under 100 or in normal range. The ideal is around 90. Oral glucose tolerance test. So if you're saying, okay, I'm taking the tolerance test where I'm taking the sugary drink and then I'm testing it 2 hours later, you want it less than 140. Again, normal range, where the ideal is about 130. And the hemoglobin A1C, which is usually the easiest and most effective, you want it at 5% or less. What the 5% does, so this is really low, right? What the 5% tells you is that you have a very, very rare, if any, blood sugar spikes. So as you get that control, you stop sugarcoating the nerves, and the nerves can recover and they can function like they're supposed to. But more importantly, you stop that nerve damage that is happening from diabetes. So if you stop the nerve damage, you've got control of at least that aspect of your peripheral neuropathy. This is Dr. Brandt Gibson, and this is